Hello everybody, welcome to another presentation of the kind of life-changing work that my team and I here at London Dental Specialists carry out on a routine basis. If you like our videos, please subscribe to our YouTube channel and also follow us at London Dental Specialists on Instagram and Facebook. So let's get into today's presentation. Actually, today's presentation is the first part of a two-part video blog on the consequences of dental trauma. Extremely common. So in this first video, the tooth was saved initially and then replaced 26 years later. And in the second, the tooth was initially saved but had to be replaced a month later. And so Laura, this 35-year-old lady, is the subject of this first presentation where the tooth was replaced 26 years later. She referred herself to see me in March this year, and she had trauma to her front tooth as a little girl. And so let's see exactly where we are. This is the tooth in question, and this is an x-ray. And remember what I was saying to you before. Root canal treatments look long, thick, absolutely beautiful. This was done by a root canal specialist 26 years ago. And this white line here, basically what happened was a colleague inserted something into that hole in the gum there, which now points on the x-ray to the fact that this little abscess thing over here, it's called a sinus, is coming from this particular tooth with the root canal treatment. As you see, there's an abscess. So what do we do? What do we do in this kind of situation? And the other thing to just even think about for a second is, why has this suddenly cropped up 26 years later? It is almost always because the tooth is cracked. Okay, the tooth suffered trauma when she was a little girl, probably about somewhere between age 8 and age 9. The tooth was severely weakened at that stage, so it hadn't fully formed and was therefore still quite weak. And it's therefore not too surprising that it was going to crack at some point. And these patients are usually told by the endodontist that, look, I'm going to do a very good job for you, but the chances of this tooth lasting the rest of your life are pretty slim. And so these patients always know and always have that at the back of their mind: one day I'm going to need to have a dental implant. So what are the treatment options in this particular kind of situation? Well, one is a dental implant, which you knew of, but the other option is a bridge. Now, in my hands and in the hands of the vast majority of people, the option that can create the best cosmetic outcome, the best cosmetic outcome, is the dental implant. And that's why I would almost always recommend it if it is possible. And interestingly, the root canal specialist who said to me, the reason why I've come to see you as opposed to anybody else in London is because I called a root canal specialist friend of mine, and he said, whatever you do, go and see a gum specialist to do the dental implant. And the reason for that is because our training as gum specialists mean that we are able, or we have the unique set of skills to keep the gum line exactly where it is. And that is what makes or breaks the outcome of the dental implant in this kind of situation. So let's actually see what happened. This is where she started. This is what she looked like. And interestingly, this was the last patient that I treated just before the coronavirus first lockdown. Interestingly, as I was treating this patient, the lockdown was being announced by Boris Johnson. So the patient came in, and this is how she left the practice. So here I have extracted the tooth, placed a dental implant, done a bit of a gum graft to really make sure that the gum level is controlled, and then we left it to it. Well, obviously we're in lockdown, so we couldn't do anything else. And so this is what she looked like in June or July. You can see that the gums look absolutely beautiful, and compared to the post-treatment and the pre-treatment situation, it pretty much looks the same. The gum line has not moved. All right, And once you have that, then it's actually fairly easy to complete the case. So this is a fragment of her original tooth that I have used to create a temporary tooth. And all I need to do is ask my technician to make her a new tooth in porcelain. And that's exactly what it looks like. You can see this beautiful, absolutely beautiful central incisor that is pretty much a carbon copy of what she had had for 26 years. The patient was absolutely delighted, and this crown was made at Unica Dental Lab, who always consistently create fantastic results for us. That's just for completeness what the dental implant looks like, and it has beautiful, absolutely stunning bone levels around it. How long did it take? 5 months. It probably would have been quicker if not for COVID-19. It cost our patient £3,500. But as you know, that every single patient that has the dental implant treatment here at London Dental Specialists gets a 10-year warranty. And fortunately, the ecstatic patient also has agreed to give us a video testimonial, which has been recorded and will be published very, very soon. So why not do what Laura, her endodontist, did or recommended? If you need a dental implant, contact us, all right? We are here and willing and open, and we're waiting for you. Many thanks.